Hi, everybody. Welcome back to the Virtual Resiliency Project. I'm here with Teresa Wukich, who is a wonderful craniosacral practitioner and chiropractic, right? You do chiropractic.
Yeah, chiropractic, sure.
And so we are here starting the series. This is like the second or third one that we've done. And what the series is about is just explaining to our community all the incredible holistic health practices that you can see a practitioner and have help. Not Western medicine, not a pill, but an actual session with someone to heal different things. And these practices are incredible for all sorts of things. And so what I'm trying to do with this series is explain what these sessions are all about. So thank you, Teresa, for coming and being with us today. And thank you for describing your amazing skills and what you do and what it can help people with. So welcome, and can you tell us just a little bit about craniosacral practice?
Absolutely. Sarah, thank you so much for doing this, for inviting me. I think your project is so necessary for our world, especially today, and I salute you and commend you on carrying this project through. I love this because people don't quite know what some of these alternative healing practices are about. At least somebody's speaking to it. They can look it up and read some sort of piece on the internet, but it doesn't quite encompass what really it's all about, especially craniosacral therapy. So I've been a licensed chiropractor for 30 years in New York State, and I've been a craniosacral therapist for 23 of those years. I love craniosacral therapy because it is a beautiful, light touch technique that allows me to actually assess everyone I see, chiropractic patients and craniosacral patients. It allows me to just see exactly what's happening more with their soft tissue components, how the spine is held up at various places along the spine through soft tissue. But craniosacral therapy, really what it is a way of releasing places, physical structures, and energetic energy. There are two components to it. There's the anatomical, and then there's the energetic, for sure. So the anatomical, in a nutshell, we have a brain, spinal cord, basically mush. It needs a cover. So the first cover is a very highly dense fibrous cover, right? And that houses our cerebral spinal fluid, which nourishes our spinal cord and brain. Then on top of that, of course, we need something stronger, like a skull, vertebra, exactly, to protect that vital nervous system. And the vertebra, of course, in the infinite wisdom of the design, they're all segmented bones, so we can move and move around. But it does allow us to protect that precious, precious spinal cord. When I'm working with somebody, what I'm analyzing really is, first of all, how the cerebral spinal fluid is actually making sure it's moving, okay? Making sure it's not held up somewhere and not moving, which if you have that, you could have things like headache, you could have pressure, you could have things in your back, any kind of physical components. You could also have energetic components that are locked up. And when I work with somebody, it's really about taking the restrictions out, basically, of any of the places along the spine. We start at the sacrum, bottom of the spine, and we work our way up to the cranium, right? And just gentle, subtle releasing of any physiological structures that might be holding that fibrous covering, if you will, tightly, okay? Because it can get locked. It's connected anatomically to the cervical spine, the neck, in certain spots, and also at the sacrum, the base. So oftentimes I feel a torsion, and I can visually see and feel a torsion in somebody's spine. And it just, with subtle releasing techniques, we can restore the movement and allow it to move, those areas to really move effectively the way they're supposed to. When we, John Upledger, a doctor of osteopathy, who I studied craniosacral under his school, I'm not quoting him, but he spoke of something called the energy cyst. The energy cyst is whereby any sort of trauma to the body, whether it's physical, okay, an accident, a fall, anything like that, and some poor habitual postural habits, okay, can contribute to this system, things being lodged in our craniosacral system. The other traumas, emotional, energetic, mental, environmental. A lot of those traumas get caught in the body, and they hang there and they hold and they basically wall off that area. So this is sort of the energetic component of the craniosacral, because there's no coincidence that when you move up the body, you're really on the chakras, which is very interesting to me. And I know he was a pretty spiritual guy.
Well, yeah, I mean, I was going to say that it totally, I mean, we both have studied shamanism, and
Yes.
the whole concept of trauma and the samskaras in your luminous field, like it sounds exactly like that.
It is. And whereas that's in the luminous field right outside, our energetic body outside, this is trapped energy inside. Mm-hmm. So as a craniosacral therapy, my job is to say, place one hand, if I'm at the sacrum, I'm placing one hand under the sacrum, one hand gently on your lower abdomen, and I am waiting for your body to start showing me how to unwind it. I'm not doing it to you. This is about your inner wisdom, your body unwinding that energy cyst out, because it knows how to unwind it out. So I would be holding and feeling, and my hands will just be going however they need to go. And I can feel it. It's an incredibly subtle feeling. A lot of people are saying, what are you doing? You know, they don't understand, because I do use it as a tool to access initially anybody I'm evaluating for chiropractic as well, because I feel like you need to address that craniosacral system even before you get into the osseous system, which is the chiropractic end of it. Because once you loosen that, sometimes these people don't need a chiropractic adjustment. They just needed some craniosacral release, which is gentle and quite beautiful. When that happens, we go and we just go along the body at the different chakra levels. And again, it is a nice release. It's gentle releasing of the body. And
Teresa, sorry to interrupt, but you must have to press your button, because we just got the picture of you. Now we don't see you anymore. Is there a way that you can change? Yeah, perfect. There. Okay, good. Yeah, that's fine. We'll just keep going.
Okay. So we just go along the body again and read. And not read intellectually, feel, right? It's when you have, as you know, Sarah, working with shamanism, right? It's, you feel the energy. It's, you know, after all these years, like, my hands are my things. And intuition. What's interesting about craniosacral therapy and the energy cyst is, yes, we can, a lot of people who have car accidents, right, or work accidents, or again, these postural pretty bad habitual postural habits because, and with COVID, everybody's at their computer. And so this is a constant. And it's really a way of really pinching off that system. And so it's a matter of really unlocking and helping your body release all of the places it's unlocked on a very subtle level to allow for that cerebral spinal fluid to flow. It's just, that's what we want. It has a pump. John Upledger recorded that. I mean, he documented that. It's different. It has a separate pump. It doesn't have, it's not the same pump as the heart or anything else. It's got a separate pump that just pumps that CSF up and down. And we want that because that is the thing that nourishes our brain and spinal cord and gets rid of the toxins. If that's locked up somewhere, because I have either something traumatic that happened to me and then I'm holding it there, that's not moving. We need movement. Motion is life. Motion is life. And we need to move the craniosacral system and therefore move the chiropractic or the spine that covers it. Mm-hmm. So I think they're a beautiful, two beautiful things to do together. I enjoy that. And that's, and so one more thing about the emotional release, there's a part of craniosacral therapy called somato-emotional release. Soma meaning body and emotion, right? So I have had, when people are on the table, sometimes I'll be at their, let's say, lower chakras, right? Their lumbar spine, their sacrum, and on the front, and they're releasing, and they will be shedding tears because things are moving, and they're unlocking some sort of emotional something that's trapped there.
Do they know what, I mean, often do they know what it was, or is it?
So I will. If I of course, always watching, mostly their eyes are closed because it's very, it's a very quiet session and it's a very peaceful session. I want complete silence unless there's some very subtle music in the background and it's just a very quiet, peaceful place. And if I see that happening, I'll have them just stay perfectly relaxed and just say, what's come up? Mm-hmm. Something came up, and they just speak to it if you'd like. Let's get it out. It wants to come out, and they will speak to it. Some people laugh. All of a sudden, they'll just start, again, energy release. It's so interesting, right? Yeah. So I love the somato-emotional part of it as well. Mm-hmm. That's a gift.
Wow.
That's
so interesting.
Yes.
So it sounds to me like it really helps people who have been in an accident, any kind of pain syndrome, any kind of like posture issues. If your back is bad and you're twisted, it sounds to me like it can be very helpful emotionally.
Absolutely.
And then what other, like who would come see you?
I have a lot of people that come see me for anxiety. Okay, so they're in sympathetic, they're fight or flight, or they're in dorsal vagal, which is like that just surrender and collapse, right? Because something's happened, something was triggered, something's not balanced. And in terms of the anxiety, so when I go to the different places and we start releasing, right? And then there's a beautiful hold. So I'll work my way up from the pelvis, lumbar spine, thoracic, up in here, like the heart area or the clavicles is a beautiful release for the upper back. And then just gently holding here by the cervical spine in the front, more of an energetic, and then coming back under the occiput, right and left sides, and releasing under there where so many people hold tension. And the anxiety posture is that, it's this, that tightly wound. And then you're making so many changes here in your musculature, in your physical being. Once we start releasing that in a very subtle way, then we come back to my favorite hold in craniosacral therapy, and that is one hand under the sacrum, one under the neck, and it's this gorgeous rocking. It's this beautiful, normally the spine should go flexion and extension uniformly, but oftentimes I feel maybe your lumbars are stuck and the cervicals are moving, or they're moving differently. But we wait, just wait, and we allow it to find the rhythm. And that's the rhythm I like to find. That is so relaxing for people. And if you think about it, when were you last held like that? Probably when you were a little one, you know? It's just that sweet, sweet thing. And it also triggers, that's parasympathetic too. So it triggers that beautiful, relaxing, rest and relaxing autonomic nervous system, which I love to bring into the conversation because it's a big part of what all of this is about. And then I go to the cranial bones. Okay, and we have, of course, already worked on the occiput, so that's one. Then we'll go to the frontal bone right up here, and it's just a subtle, Sarah, it's almost like, you know, the feeling of having like a nickel, placing a nickel. That's the amount of pressure, okay? So it's a subtle just lifting of that beautiful frontal bone, which does relieve a lot of, number one, tension, sinus issues, frontal sinus headaches, you know, headaches of sorts. You'll find that people, like, I'll be feeling and saying, did you ever have some sort of injury when you were, because I could feel it stuck on one side and the other, and they'll say, oh yeah, when I was a kid, I fell off my bike, I hit my head. I mean, that could be how long ago it is. And it just gets stuck, right? We just want everything to move. So lifting that, then I'll go to the parietal bones, lift those, release those, then to the sphenoid, right here by the eyes, which is that gorgeous butterfly bone that floats in the skull. And that houses part of the eye socket and also the ethmoid sinuses, your sinuses right here, you know, your breathing sinuses, and people feel a lot of release, especially with sinus stuff there as well. That should be a mobile bone. That should be moving. And oftentimes it's not. You feel the subtleties of things just not quite moving. And again, it's not forcing anything. Craniosacral therapy is sort of like less is more. So just with soft, sustained touch, things move. It's almost like a metaphor for life, right? Instead of pushing somebody to do something or be somebody, it's subtly, you know, just a little bit of support, right? Goes a long way. And then we do the temporal bones, right back here, okay? And then there's, you know, a bit of the ears with that, just to align a little bit of the eustachian tube and just all of the connections within the brain, all the, you know, because of course the brain has different compartments. So there's this connective tissue in between that's attached to our skull bones. So we want to just make sure everything's moving so there's not torquing and tension on the brain at any point. And then the last is the mandible, right? So it's just a gentle release of the jaw.
So I could see it being helpful for, you know, what's that, mandibular joint issue?
Yeah, TMG.
Also, earaches. Do you do like people who have ear, kids with ear problems?
It's interesting you say that because I use the craniosacral. It's so non-invasive. I use it on newborns, infants, children, older people who I am certainly not going to give an osseous adjustment to. And it is such a beautiful release for all of these age groups. that I'm so happy I have it to offer, because I do see wonderful effects with this with children. Yeah.
So, you know, as a pediatrician, you know, the main thing we
Exactly.
see is, you know, ear infection. So do you have success with that?
Yes, I
Yeah.
do. And then, of course, we look to different dietary changes with that as well, and different, you know, environmental things. We want to bring in a lot of different avenues on. But oftentimes, I do see that the craniosacral system is locked up here, right?
Mhm.
And then it's also, and that corresponds with the cervical vertebra being locked. Okay, it may have been through the birth process. Were they in utero? How were they sitting? You know, all that, or slipping and falling as a child. Who knows?
Yeah.
But again, very gentle, even chiropractic in terms of just vibrational, just to feel, and maybe just again holding those vertebrae until they just allow themselves to release. That combination, and working with the ears, giving parents things to do at home to help their child, like different exercises to help drain, you know, unless there's some, of course, Sarah, as you know, some anatomical thing going on that really contributes, right? So
Ah,
it is helpful, and I love that. It's
so
helpful for a lot of different things as we're talking. Yeah, it's bringing it all up.
typically, like, do you have people coming back and back and back, or what, you know, they have a headache and you release and then they're off on their own, or like, how does it work?
Yeah. Well, they will come for a session, and the typical first session is an hour, because we want to really assess what's happening. I want to really spend a lot of time. I don't want anything kind of, you know, rushed through. So that typical session is an hour. I will work with them not on the chiropractic table, but on the massage table, have them all set up with something under their knees, if they need something under their head. And they'll be face up. Okay, there's no face down with craniosacral, it's face up. And I'll have them maybe with a cover if it's cool, because sometimes doing this work, people get cool. So you want to make sure they're nice and covered, have some nice gentle music playing if they want. Some of them just say no, very silent. I have one person that comes that doesn't even want my clock in the room. She's so in, and she just said, I don't want anything, nothing. So, you know, it's interesting how everybody's interesting and different. And that's the other thing. Everyone's different.
Right.
So it's not a one size fits all, you know, come back every week for whatever. It all depends. And then I will assess, and I always assess chiropractically as well when I'm especially up in the head and the neck and even in the lower back and stuff. And then I'll give them things to do at home that will help. Sometimes if they're really, let's say, going through some anxiety and they really don't have any tools to even begin, how do I even begin? I may even guide them while I'm working with them through a body scan, right? Where I'll just have them focus on something just to get their mind to relax. And then we'll go through some breathing techniques, and they can take those home, right? So it's practice those breathing techniques at home, just that alone, once a day, extended exhales, all of that. So it just all supports, as you know, it's a whole system. And so we bring in all these different things that help, right? Support.
I remember when you did a session on me. Oh my God, it was so beautiful.
Greece.
So anybody who wants to try it, unfortunately, Teresa is in New York, and most of the people going to be watching this are in Boston. But if it passes through our Facebook page and to people in New York, we're going to put Teresa's information below below this, and we're just trying to get the information out there that these are the types of things. If you're suffering with anxiety, or if you have a child with ear infection, or
Yes.
for pain, you know, try it. My view is try any of these things and see what works for you.
Mm-hmm.
Thank you all for
Yeah.
coming.
And I would say,
yeah,
Sarah, quickly, if someone needed to find somebody, right, they're looking for
yeah,
craniosacral therapy, I would say number one, ask your friends, ask people. You want that personal referral first, right?
good
You
idea.
want someone to say, oh my gosh, I went to that person, they're wonderful, they're this, that. If not, go to the internet, look it up and see, and then really investigate how they practice, because you really want someone who is more of a holistic practitioner and not really in a sterile environment, so to speak.
So do
Okay.
you know people in Massachusetts that if they wanted to contact you?
I can't say I do, but if they wanted to contact me, I could certainly find some that I feel I would be comfortable to recommend based on what their websites are like or anything like that. Yeah, I'd be happy to.
That would be wonderful. Thank
Yeah.
you. Thank you for coming. And maybe we'll do another session on what, you know, a little more about chiropractor.
Whatever you think, I'm here for you. And thank you so much for inviting me. It's like I said, it's just an honor to be part of this.
Well, and thank you all for tuning in. And I hope that this helps you. And I hope that you get some relief if you try craniosacral. So until next week, see you later.